This young patient, Suman Subramaniam, from Canada, the first time he came to India was in search of a fistula treatment. Back in Canada, this Suman was probably wrongly diagnosed to have a pilonidal abscess and was drained multiple times by few surgeons in Canada. Finally got an MRI scan, and MRI revealed a very complex fistula. And there in Canada, one of the surgeons said he needs to have a Seton lifelong and he may not get cured at all. So that was the time he explored, and he came to Bangalore in search of a fistula surgeon. It was by accident he found Smiles, and he came to the scanning center and saw a board. So then he walked into my clinic and he consulted and said, when I saw it was a very complex fistula, so this is how the fistula was. In fact, we have seen much more complex fistulas than this. So then we had different approaches to handle this fistula. For us on the operating table, what I thought to be very complex turned out to be very simple to handle it. So now post-operatively it's about 2 months time, and he decided not to go back to Canada until it is completely healed. Now Suman is completely healed.
Hi, my name is Suman Subramaniam. I'm from Canada, and I came to Smiles to get treated. So my story begins back in Canada when I originally had a pilonidal abscess. And what happened with that was I went to go get it treated at a hospital, and I probably had it drained maybe 4 or 5 times until eventually they said, okay, you need to see a surgeon. So I ended up taking an appointment with a surgeon, and I met him at least 2 times, and we discussed the different options, and he said, we're going to basically surgically remove the abscess. And so I said, okay. And so basically maybe I would say 2 months after the date of my first appointment, I booked surgery. I underwent anesthesia. I had the pilonidal abscess removed, and things started healing normally for a bit until I started to notice there was a sign of infection, or it felt that way anyway. So I addressed my concern to my surgeon back in Canada, and he basically examined the wound and he said, there's nothing to worry about. Just continue going to get dressing changes at a clinic with nurses. And so I continued to do that. And my nurses were upset. They told me that you need to go back to your doctor and explain that there is an infection. So I went back, and he still said, like, I don't see any signs of it. And he sent me back to my nurses. So at that point, there was the infection did develop more than it should have. And so what happened was the nurses, they took some packing, and they basically they packed the wound in a way that the doctor would be able to notice that there's a clear sign of infection that has passed through the abscess. So when I went back to the surgeon, he said, okay, we need to make an incision again and drain the wound. So that's what ended up happening. I ended up having it drained after surgery. And then after that, things started to heal normally again until I started to feel a lot of pain when I would sit. It was excruciating pain. Like I had trouble walking when I was sitting, it would hurt, and I explained my concerns to my surgeon again, and he examined the wound and he said, I don't see anything. So I started to notice pus coming from the wound, but I couldn't locate it exactly where it was. And I would say maybe I had my abscess in 2017. I had surgery in April 2018. And then by the time July of 2018 came around, I addressed my concerns that I'm starting to see pus, I'm starting to see other things going on, and I'm not sure exactly what it is. And so again, the doctor, he said, I don't see anything, I think it'll pass, just give it some time. So I said, okay, like I put my trust in him. And then eventually I continued to go see the nurses at the clinic. And eventually one of the nurses said, hey, has your doctor ever checked the below the wound, any anal region areas? And I told her no. And then she said, okay, like let me check to see if anything's going on, because I don't know why your surgeon hasn't done that. And so the nurse, she ended up examining me, and she said, I see a small opening. And she asked, do you mind if I probe the opening? So I said, sure. And she probed the opening, and she said that she was able to get about 5 centimeters in depth into the opening. and she said that this is definitely like something past. This is something different from an abscess. So I ended up going to my surgeon again after multiple visits, and I addressed my concern, and I asked, what should we do? Should I do a scan? I knew nothing about a fistula at the time, but I asked, should I do a scan? Should I get a blood test? Should I be on antibiotics? He said, no, look, come back in 2 weeks and let's see how the wound heals, the fistula heals. So I come back in 2 weeks, he examines the wound, still nothing. So he says, you know what? Okay, let's wait 1 month and come back and let's see if there's any progress. Still no medication, no scans, no nothing. So I come back in a month's time, and then he examines the fistula again, and still it hasn't healed. So he said, you know what, come back in 2 months' time. So at this point I'm getting worried, but it's very hard to find another surgeon back in Canada that's specific to anything colorectal. So I put my trust in him. I said, okay, I'll come back in 2 months. And eventually I came back, and he basically said, you know what, come back in 1 more month. If we don't see anything, you might have to find another doctor. So I waited again another month, and then again, surely, without doing any scans, no blood work, no medication, no nothing. He basically, when I came back a month later, he said, okay, this is out of my hands, go find another doctor. So eventually I had to go through the process of finding another specialist again, and I found a specialist, and basically he said, okay, you're gonna have to do an MRI. So it would take 2 months for me to get an appointment to do an MRI. So I waited 2 months, I got an MRI. At this point it's 2019. So from 2017 we're pushing to 2019. I did an MRI, I believe, in March of 2019, and basically the MRI report showed that I had a fistula that I guess was greater than I expected. I just assumed it was one long passage that was about 5 centimeters, and it seemed to have branched out into other areas. So I went to go see the specialist again with the report, and what he told me was that he believes that even with surgery, I won't be healed. So he basically told me that what we would want to do is put a ceton placement, but he said he's 100% sure that this won't heal, and he said you're just gonna have to live like this for the rest of your life. So I was really upset, and I don't know if he was trying to make me feel better, but he basically said that you should be happy because there are other people in different parts of the world that can't even get a doctor to see their fistula. So there are some people who can't even get medical attention, so you should be happy that you could at least receive treatment. And I said, but even if I receive treatment, it's not going to heal me, right? So I was upset about that. So basically what happened was they told me we're going to book a surgery date for you, and we're going to put a ceton placement, but he had already told me that it's not going to work. So what I decided to do was, instead of take that as an answer and just give up, I decided to research online. And I watched a bunch of videos. I started researching different surgery methods in the United States and in the UK and other parts of the world. And then I came across a video of someone who originally did a surgery in India, in Bangalore. So I saw that they said there's a Facebook page that you could join, and you could see all the people that are currently doing the surgery and have done the surgery. So I decided, okay, let me join the Facebook page. And I joined the Facebook page, and I started speaking to other patients, and I was hearing people's stories, and I was convinced, okay, let me go to India to get surgery. So I ended up going to India in August of 2019, and once I arrived there, I came for Shar Sutra originally, but the doctor that I went to go see, he asked me to do a scan, and I went to go do the scan that he asked. Then he asked me to do a colonoscopy. He wanted me to do a biopsy report. He wanted to make me do all these tests. And then once he got all the results, he said, even if we do the test, your situation is very complex, and the odds of Shar Sutra working on you is 50%, if not less. And he basically said that I would want you to stay in India for 3 months, and only at the end of the 3 months can I even tell you if there is any progress. So I can't even tell you 1 month or 2 months before. I want to give it 3 months to see if there's any progression. So those percentages were too low for me, that I told him I would need to take a moment and basically weigh my odds, because that's a big risk to take, especially staying for 3 months, potentially longer, and like have it fail. So when I had done my scan originally that the doctor had asked, I saw that there was a clinic right across the street from the place where I originally did the scan, and it was the Smiles clinic. So I was speaking to my family back home, and I told them that I see another clinic, and they seem to treat fistulas, piles, and other colorectal, I guess, infections. So my family said, go and get a consultation with them and see what they say. So then I ended up going to get a consultation with Dr. Parmeshwar, and he basically saw my scan, and he reassured me that he could guarantee me a success rate of, I don't know, like I guess over 95%. I personally would say, if not higher. And he basically said that, like, he looked at my scan, and with confidence compared to the other doctor, he said, you know, like, I could treat you. You know, he's like, put your faith in me, and like I could help you out. So I went back home and I spoke to my family, and I asked them, like, what should I do? And I told them, like, this is what's going to happen. And they said, okay, you know what, this seems like the best idea to do. Your percentages are much higher. This doctor seems much more confident. Like, we don't see a reason why not to go for it. So I said, okay. I called the doctor, I booked a surgery date, and I ended up having surgery September 18th. And then, yeah, basically that was it. So I went into surgery, and then from September 18th after the surgery was basically just recovery time. So I would basically come in daily for wound cleanings. I would meet other patients. I would see other people, and I would see I would see the staff. To be honest, like, the staff was like so helpful, especially the wound cleaners. Like, they did an amazing job. They were able to tell me how the wound is doing, how how it's healing. They were able to give me like pretty accurate details about it. And while I was here, I wasn't the only international patient that came to Smiles. So there was other clients that have come as well. And I have a scan of my fistula. So, like, this is my fistula. And I originally thought that this was complex. So I thought, like, it can't get worse than this. I look at my fistula, and I thought this was a pretty complex fistula, and I thought, everyone kept telling me that this was one of the worst they've seen, that it can't get worse than this. And then eventually, once I started coming here after the surgery, and I started meeting other patients and seeing all the other patients that had surgery, I started to realize that I'm not the only one with a complex fistula. There are people with the same fistula as me, and even worse, And so that was reassuring to know that, like, I'm not the only, like, person here who's reached out because their hometown, their home country couldn't heal them, and they flew all the way here, and basically they found reassurance knowing that no matter how complex their situation is, they could be healed, And so that was reassuring. So from there on out, I basically just continued to come to the hospital, meet the doctor, meet the staff, continue to get healed, and eventually I did get healed. So, and now here I am in front of you guys, and basically I could say that it worked. I'm 100% healed, and I could go back to Canada. When I was in Canada, I had to quit my work. I had to quit school, and I was basically just at home. Like, I had trouble, like, sitting, walking, like, I felt useless, and now I feel like I could go back and basically start off where I left off. And so, yeah, like, just like the name says, like, you can Smiles, like, it lets you leave with a smile. So, yeah.
He's flying to Canada with a smile on his face. Like Suman, we have many patients from different parts of the world, the United States, Canada, UK, the Middle East, the Asia Pacific region. Different parts, people come with complex fistulas, and we are very happy that we are bringing smiles on people who are suffering from fistulas across the globe. The recurrence rates with us in the last 7 years is as less as 3%, and people have the fear of losing control of the sphincters. Count on Smiles that you will not have you will not have incontinence problems, and the recurrence rates as the least in the world. Count on Smiles. So this is it I need to share about Suman. Thank you.